Hi. So this video is for you if you have cancer. It's a likelihood that you either have or will have the symptom of brain fog, also known as chemo brain. But it's important to note here that yes, it's a common side effect of chemo. That's why it can also be called chemo brain. But the symptom of brain fog, you can also get it from other therapies, radiation, immunotherapies. But also, it can just come from the cancer itself sometimes. Even before treatments like chemo are started, there's already a higher base level of inflammation in someone who has cancer. It's an inflammatory type disease. So, it also, even if you go the completely natural route, it is possible you'll still have some brain fog, perhaps. And this can include things like memory problems, whether long or short term memory recall, confusion, lack of concentration, inability to focus. It makes learning things harder, it takes you longer to do things. There's cognitive impairment, you're not all there. It's like, yeah, this brain fog. I think you get it. So, it can be really helpful to have nice, safe, natural remedies to deal with this, either to prevent it in the first place or lessen it if you already have it, potentially even take it away completely or at least lessen it. Because this can be a debilitating side effect for people. I mean, especially when you think about like all these changes occurring in your life, especially if you're, going more the natural route and you have this whole new, daily regimen, lifestyle changes. If you have brain fog, it makes it really difficult to remember what to do and focus on all that, and which can be really frustrating, which can give more stress, and stress is not good during cancer. And even if this is not your situation, this intensive lifestyle overhaul, still the brain fog can lead to just interfering with activities of daily living to a point where it can be very stressful. So, I'm going to get into some natural things that can help with that. And the beauty of a lot of these natural holistic remedies is because of the nature of them being holistic, they're not only good for this one thing, but they're good for all types of other stuff too. So you get all those types of health benefits. So first, I'm going to get into really specific things for neuroinflammation backed by studies. Then I'm going to get into a specific category of things that can be helpful. Then I'm going to get into not just, supplements, herbs, whatnot, but certain other types of therapies that can help. And then I'm going to get into some things you can do at home, like at home techniques and therapies, so to speak. So yeah, we're going to run the gamut here a little bit. And also know this is not an exhaustive list of things. I'm going to give you a good amount, but that doesn't mean these are the only things in the world that can help with this. So always keep that in mind. And by the way, hi, I'm Dr. Lisa Mateka. I'm a naturopathic physician, energy worker, and transformational life coach, and I help those with cancer navigate their journey back to health and wellness to an even better state than before, physically, mentally, emotionally, energetically, and spiritually, perhaps. That is what I do. So, and there's a lot of ways I do it, but that's another story, I guess. So let's dive right into these natural remedies for brain fog or chemo brain. Okay, so starting with things that are specific for neuroinflammation. Now, anything that reduces this neuroinflammation is automatically going to help cognitive function, specifically attention and processing speed. Attention and processing speed. Now, it is technically better to start these it is technically better to start these, supplements and things before you start chemo if you're starting chemo, and that also goes for radiation, any other drug therapy. But even if you already have started and you already have this symptom, it's okay. Do these things and it should help. So, also, I'm not going to really talk about dose. This is something you still want to talk to with your, and I don't even want to say oncologist because they're not going to be most likely knowledgeable in this kind of thing. So this is something you still want to check in with your naturopath, your herbalist, your whatever, holistic health practitioner of some sort, because first you want to be sure there's no interactions with anything else you're taking, and then also to know the therapeutic dose, because that can vary based on a lot of different things. So I'm not really going to be getting into dose and whatnot. Okay, so the first one is ginkgo biloba. Ginkgo biloba. This one you may already know is good for the brain. It's famously taken for memory, concentration, and increasing cerebral blood flow, because it does do that. It also happens to be an adaptogenic herb, an adaptogen, which means if something's an adaptogen, it means it really helps the body to adapt to stress and stressors. It basically brings things into a state of harmony, equilibrium, balance, so to speak. And that's metabolically and systemically. So the herbs are amazing in that way, because they do a lot and we don't even fully understand exactly how they do it all. So it's an adaptogen, helps the body adapt to stress. Studies show that it does decrease cognitive impairment in those with mild impairment. So it does increase, cognitive function in those with mild impairment, has been shown to do that. And it reduces, for those of you interested in the sciencey stuff, it reduces the neuroinflammation via NF-kappa beta regulation. It reduces IL-6 and HSCRP, even in those with metabolic syndrome, which is like a pre-diabetic state. So if it can reduce those in people, basically that are pre-diabetes, then that's a big deal, and that's a really good thing. And yeah, HSCRP is something I pretty much always will look at in a patient's blood, because it's just sort of a general baseline level. It'll show you a general baseline level of inflammation that somebody has. So ginkgo biloba can actually bring that down, which is very cool. So the next is Bacopa. Bacopa moneri, depending on how you say it. Bacopa is also an adaptogen. It's a wonderful adaptogen. It's also a nootropic. You may have heard about the nootropic craze more recently. Nootropics have been called smart drugs. They have been known to increase cognitive function and brain health. There's a bit of controversy around some of them, because some people are claiming things are nootropics. Anyways, the point is, Bacopa happens to be an adaptogen and a nootropic, so that's cool. And studies have shown that it does increase cognition and processing speed. Now we have ashwagandha. Ashwagandha. This one has gained popularity, so perhaps you've heard of it. Ashwagandha is Withania somnifera, and this is a primary adaptogen. That just means it isn't just sort of general, but it has proven to work and balance multiple different types of body systems. And in studies, ashwagandha has been shown to increase synaptic plasticity, which is great, because what that essentially means is it's enhancing, improving neuroplasticity, which means the ability of the brain to like rewire itself, our ability to like reprogram and rewire our brain. So it's not just stuck. So that's a good thing. And also has been shown in studies to reduce microglial inflammation. And the microglia are the cells in our brain that are the primary and first components of our active immune defense in our brain. So very important. So it's going to reduce the inflammation of those, which is great. Ashwagandha. So I'm going to name 3 things that have been shown in studies to reduce neuroinflammation by regulating those microglia. And that is curcumin, which we know that as a powerful anti-inflammatory, so perhaps no surprise, curcumin. CBD, cannabidiol, CBD, that'll make some of you happy, and resveratrol, which is a component found in wine and grapes and things like that. So now we're going to get away from the herbs and into the mushrooms. This next one is my personal favorite thing to give, my number one go-to. That's just me. And that's lion's mane mushroom. Lion's mane mushroom, Hericium erinaceus. And this has been shown to be neuroprotective, anti-inflammatory, and has been shown to improve cognitive functions. And I think I like giving this one not only because it's great for brain fog, but it's just in general, mushrooms are a pretty good thing to give someone who has cancer. So that's a pretty good thing to take if you have cancer. They have all these immunomodulatory actions and different things that makes them really good. All right, and now we're getting into a hormone, which is melatonin. So I will give a dose on this one because most melatonin, when we use it for sleep and things like that, is like 3 to 5 milligrams. So this is a 25, at least this study used 25 milligrams. 20 is considered the anti-cancer dose, but specifically this study used 25 milligrams of melatonin over the course of 6 months. Now this study wasn't a cancer study. It was actually patients who had multiple sclerosis. They're not doing so well neurologically, to put it lightly. So if this helped them, then I would say it definitely will help you. But this melatonin decreased pro-inflammatory cytokines such as IL-1 alpha, IL-6, TNF alpha, lipoperoxides. And the TNF specifically, tumor necrosis factor alphas, those are associated with poor performance on testing, cognitive tests. So so the melatonin can help with this as well. And then something that has also been proven to help with neuroinflammation, that's not a supplement at all, is intermittent fasting. You could call it overnight fasting. So intermittent fasting, is like a 12 to 16 hour window between the last thing you ingest of the day to the first thing you ingest the following day. Now, this does not just include food, but it also includes beverages that are not water or herbal tea. So basically, the last thing you ingest of the day, besides water, herbal tea, and then time it to the very first thing you ingest the next day. That's not water or herbal tea. And that window, 16 is kind of the magical number. That's kind of the best number. 16 hours of no food or drink besides water and herbal tea. So then you're basically eating over an 8-hour window throughout the day. That's what intermittent fasting is. It's technically considered anything over 12 hours, but 16 is a really good number for those who have cancer. And it has been shown to decrease neuroinflammation as well. So those are some supplements, and the overnight fasting, which is not the intermittent fasting, which is not a supplement, that are specific for neuroinflammation, proven with studies. And now I'm going to give you some general things that people definitely can still find helpful, and that is any adaptogen. So any adaptogenic herb or mushroom. So other mushrooms include reishi, cordyceps. I still don't think they're as good as lion's mane, but they are considered adaptogens, so they can still be helpful. Reishi, cordyceps. There's a lot of other herbs that are classified as adaptogens. You just have to sort of look that up and see, but things like rhodiola, schizandra, holy basil, Eleutherococcus sentacoccus, which is Siberian ginseng, and then also Panax ginseng. These are some examples of just overall adaptogens that can help. And again, adaptogens are things that help the body to adapt to stressors, regulate stress, to sort of attempt to bring about a better state of equilibrium and balance metabolically and systemically. And when you think about it, it makes sense why just taking any sort of adaptogen could help with chemo brain fog, because everything is working together as a system. So even if it's not specifically targeting the body, the neuroinflammation, the neurological system, uh, working on other parts of the body, if those things are becoming more in tune, more in balance, more effective, it's going to have a cascading good effect on everything else. Now, this is more of a naturopathic principle, but it totally makes sense. Our body is this beautiful, holistic machine. Everything is interconnected. Everything has an effect on everything else. That's not something taught in traditional medical schools. And in fact, it's really no longer taught in naturopathic medical schools too. I was one of the last classes where they moved from this sort of holistic curriculum to more of a systems-based curriculum where they kind of divided everything into systems. And yeah, that's just not such a great thing, in my opinion, this sort of agenda to make us less knowledgeable and less aware of the interconnectivity of everything. But I shouldn't be going off on a tangent on that right now. So back to things that can help your chemo brain fog. So if you're not so into taking a bunch of supplements, here's some practices, some other therapies that can really help brain fog, chemo brain, and that is massage and acupuncture. Massage and acupuncture, which are also great things in general. Acupuncture is a really nice complementary modality for cancer. So how and why do these work? Well, I don't have the scientific data to say exactly why, but my guess would be, massage is a nice, relaxing, calming, stress relieving therapy. And anything that's going to sort of relieve our stress and help us calm down is going to basically help inflammation and everything else. Because stress is an inflammatory state. And acupuncture, also, there's probably something to be said about just the squeezing of things and getting things squeezed out of places. And acupuncture is also a very holistic system of medicine. Like I was kind of explaining earlier, it's just the body as a whole. And acupuncture is looking at the energetic meridians. And if it can free energy from some of the, some stuck energy, then everything can flow a lot better. And that's pretty much what it boils down to, is anytime there's stuck, stagnant energy, or qi as it's called with acupuncture, I mean, that's basically the basis of all our problems. Any sort of pain, dis-ease, negative emotions is really stuck energy. And I know the solution isn't simple, because then it's like, okay, well, how do you free this energy? There's so many different modalities, and not all of them work all the time, because it can be hard to know where the energy is trapped and how to free it. And you can only do so much at a time. Okay, now I'm going off on another tangent. That conversation gets complicated. But anyways, acupuncture, my point being, acupuncture is a proven technique that does help free energy, and it does happen to help brain fog, chemo brain, amongst many other things. Okay, and then lastly, I'm gonna go through some things you can do at home to help. So one was already mentioned, intermittent fasting. That's something you can do on your own at home, intermittent fasting, and that one does decrease neuroinflammation, backed by science. And another thing is MBSR, mindfulness-based stress reduction. Mindfulness-based stress reduction. So this is something you can practice at home that is going to help with a lot of things, including brain fog and chemo brain. And what does that mean? How do you do this? Well, okay, so if you're already versed with mindfulness meditation, then just do that. If you're not, then okay, then you're gonna have to, read a book or take a course or get some guidance on how to do that. There's a philosophy to mindfulness, and actually MBSR, mindfulness-based stress reduction, is somewhat specific because it's really helps. It's like more of a specific protocol and guidelines that can help people to relieve their stress. So that's something to definitely look into. A wonderful tool in your toolkit for life in general. And then we have aromatherapy. Aromatherapy. So that can be diffusing essential oils. That can be just opening the bottle and smelling the essential oils. It could be putting them in the bathtub with you. It could be maybe creating, mixed with the carrier oil, creating a nice little topical, oil for yourself to treat yourself with. There's a lot of different ways to do aromatherapy, and there's some herbs, of course, that are going to be better than others. And I don't have the full list or anything, but rosemary is a great one. Rosemary essential oil really does help the memory and cognitive function. So that's a wonderful one to start with, is rosemary aromatherapy. Get it in however you can. Sniff it, put it in a diffuser. If you do rub it on your skin, mix it, with a carrier oil like coconut oil, olive oil, almond oil, jojoba oil, whatever. And then we have 30 minutes of aerobic or resistance exercise. So the last one is 30 minutes of exercise, whether it's aerobic or resistance, which is like weights and whatnot. So yeah, 30 minutes. Maybe you already do that, so you'll probably have a leg up in the game. If you don't have a workout regimen, it actually is not a bad time to start. Even just walking 30 minutes a day is a great thing to do for cancer anyway. It has to be a brisk pace though. But yeah, exercise, I mean, it makes sense in a way. Exercise has such positive benefits on literally every organ system, every function of the body. It's really an amazing therapy in itself. So, all right, well, I hope you found some of this helpful. If you don't have brain fog or chemo brain yet, it wouldn't be a bad idea to maybe start some of these things if you are wanting to prevent. If you know someone with cancer, share this with them. If you know of any other great remedies for brain fog, feel free to put them in the chat, in the comment, not the chat, in the comment section. And yeah, let's share our ideas. And I hope you found this helpful. And until next time, much love, everyone. Much love on your cancer journey.